And what becomes really important for them is that they really bring that local perspective, that local knowledge and experience to that leadership and governance. So we're working together to develop a model and a space so that their work was always grounded. My name is Braden Te Hiwi. I come from the west coast of the North Island of Aotearoa, New Zealand, and so I'm a faculty member in the Indigenous Studies Program at UBCO. And so for me, it's about bringing an Indigenous perspective to the research and to the teaching that I do. When thinking about the goals of my research, probably two things come to mind. Firstly, is that Indigenous perspectives, knowledges, ethics, and so on become centrally important to the work. And then the second thing, in terms of an area or focus, is around health and well-being. And that way, the community connection or community-based work becomes an important part of what I do. When people think about health and well-being, they'll often think about things like the healthcare system, and so I have an interest in that, or a medical focus on disease. But I'm also interested in what you could call traditional Indigenous approaches, whether they focus on things like land-based programs or language in health. And so I tend to think about health quite broadly in that way. And then also thinking about how potentially those two different perspectives or backgrounds or paradigms can come together. A couple of the projects that I'm working on at the moment, one of them is in partnership with Aboriginal programs and services. We partnered with them to create a program for young Indigenous men. And in particular, we focused on the ways in which identity became really important to understanding their well-being. I also partner with the Okanagan Nation Alliance, which is an organization that represents different Okanagan communities. And they're really interested in how to better lead and govern these communities in terms of health. And what becomes really important for them is that they really bring that local perspective, that local knowledge and experience to that leadership and governance. And so we're working together to develop a model and a space so that their work was always grounded in that particular way. The types of research partnerships that I'm interested in is really quite broad in scope, as long as there is some kind of interest and understanding of health and well-being in a project. For me, one of the key things that I think about is the give and take, or the reciprocity of things. And so it's really important that if we were to bring together an Indigenous community organisation, or any organisation for that matter, along with people, researchers and so on, that there's a give and take and a balance in that. And so all those different perspectives or stakeholders have something to share and to give, and also that there would be something in it for them in terms of being able to meet a community need or whatever it might be.